I will say, unfortunately, there is some limitations of our current research where we are now. One of our main limitations is the underrepresentation of African Americans in clinical trials, particularly those for our disease modifying therapies. All clinical trials for multiple sclerosis have less than 10% African American participations, and most of them are enrolling less than 5%. Now, if we think about it, African Americans represent 12 to 13% of the US populations, but only making up 5% of clinical trial participants. Therefore, it is very difficult for us to know the true effects of disease modifying therapies in the Black community. There are some additional limitations that we have in our current research. A lot of our understanding of how MS affects the Black community comes from observational studies or retrospective studies. These are studies in which they take a group of patients and they look backwards over their past history and see what characteristics about their disease exists and see what they can pull out of that information. Although this does provide valuable information for us, it also has a lot of limitations. One main limitation of that, again, is the small patient numbers. Oftentimes, these observational studies or retrospective studies involve maybe one clinic, maybe a group of clinics. And so the chances of having a diverse patient group, even among African American population, is limited. Additional limitations of our observational studies is that they oftentimes do not take into account some of the socioeconomic factors, such as health literacy levels and how our patients in the Black community are able to maneuver around the healthcare system, access to healthcare, sorry, and that includes insurance coverage. They also don't take into account our social and cultural beliefs as well.